Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. What happens if an LIP is rude to you? Let's do a scenario. So you're working on the floor. You have a COPD patient who came in with COPD exacerbation. They're non-compliant with their home. Now I'm blanking if they have home BiPAPs or if they wear CPAPs. Anyway, they're not compliant with their setup at home, and they won't wear a BiPAP at night in the hospital, even though their CO2 levels are climbing. So you see the NP, you let them know that they're refusing to wear their BiPAP and their oxygen is 85%. Maybe they live there, at home with chronic COPD, it's not too far off from their baseline. Sometimes those patients live like 88% all the time. So, maybe it's not too far off. He's not in distress, so the NP isn't prioritizing it. He's already got a nasal cannula on, but you're concerned, so maybe page them again. And you hit a nerve with the NP and they say, just put a Salter on them. Do you know how to do that? The shade. Trying to peg you as incompetent. Don't stay in that distress. The best thing to do is face that person. It might be scary. It is scary. Trust me, as a conflict avoidant person, I feel like I'm going to throw up when I do this because you might just be used to letting it go. But in reality, you don't let it go. You might think about it later. You might ruminate on it for much longer than you should. It might prevent you from going to that NP in the future, which is not good for your patients. And the NP might get used to talking to nurses in that condescending manner. You got to nip it in the bud. If you want to embarrass the crap out of this nurse practitioner, you call them out on their unprofessionalism in a professional way. You pull them aside when they're alone and you say, hey, so-and-so, I need to let you know that the way that you spoke to me regarding 82 and putting a Salter on them was unprofessional. I am a competent nurse with a concern. I came to you respectfully, and I deserve that respect to be reciprocated. They will look like a dumbass because they are the LIP. They should be holding the highest level of respect, and you shouldn't have to be the bigger person. You have to have that underlying level of respect, though. And you have to speak to people with that professionalism and respect in order for this to work, in order for them to reciprocate it. If you spoke to them with respect about a concern and they snap back at you, you absolutely have grounds to confront them about it. And you'll also feel amazing for standing up for yourself. And you can tell the oncoming RN in the morning or at night about it. But I assure you the NP, the LIP will speak to you differently next time.